All right. So I'm going to welcome in some folks who are joining. Welcome before we get started. But yeah, without further ado, I'm going to hand it off to Rudolph from Hunu.
Okay, good morning everyone, and thank you for being here. I'm really excited to be here with you to talk about the work we're doing to improve learning outcomes for children with behavior and developmental challenges like autism. So maybe one of you, or you might know someone who has a child with a behavior or developmental challenge like autism, and you definitely know that it's not an easy thing. It's financially and emotionally draining, and if that's not enough, that feeling of helplessness takes a toll. Currently in Ghana, there are about 190,000 families or individuals, especially in hard-to-reach communities, who are going through this. And studies show that web-based processes and collaborative problem solving, training in collaborative problem solving, tend to take away some of the structural barriers that therapy providers face in collaborating with parents and teachers to support children with such challenges. And so what we've done over the last couple of years is to take all these learnings and more to build a tech-enabled solution that really facilitates collaboration between parents, teachers, and therapy providers to improve learning outcomes for children with behavior challenges like autism. And all of this really started somewhat 14 years ago when I made the bold decision to work with my mother. We set up a therapy center in Kumasi, Ghana. And during that time, we were trying to think about how we work with parents remotely. And so we said, yes, let's get WhatsApp working. And that was difficult, largely because there were no automations or chatbots. And so we had one person manning the phone, and then whenever it got lost, there were terrible delays, and people weren't happy about that. And so one of the first things we decided to do with Hunu was to try and figure out how we make information available to parents and teachers to make informed decisions and do simple things like screening for behavior challenges like autism through their phones. And so we built a chatbot for that. So what we now, after some time, we said, well, this is kind of boring. Let's get some more work done. And so we figured out how to understand the conversations and match parents, teachers with therapy providers. So we embarked on that journey to really build a network of therapy providers where we match them. Then they work together to build evidence-based intervention plans that are focused on two things: academic and behavior development skills. And that is also, so when that is going on, we try also to provide technical support to therapy providers who then understand how they can leverage the data they are getting from our platform to really make informed decisions with the parents. And we also really understand the challenges that come with delivering therapy. And so what we did was we reduced the admin time, track behavior challenges and metrics, and also enable them deliver therapy as much as possible, so do the work that they can. Over the years, we've learned a lot, and it's been interesting so far. But our team has reached about 1,000 families, helping them learn how to make single word requests and sometimes go back to school. So that has been good. I'm happy to say we have finalized our partnership with the Ministry of Education and UNICEF Ghana, and we'll be training 34 special education coordinators to deliver tech-based solutions in assessment centers. So, as we are here today, I'm really looking forward to talking to you about how we can make education truly inclusive. Thank you.